Hi, I'm Allie Cook for the Dental News Network. Today is July 11th, 2012, and this is your Wednesday Watch. Here are today's top stories. Today, there is more trouble for a certain large dental provider. A company behind a chain of dental clinics has mistreated pediatric patients and was caught breaking healthcare rules so often that U.S. regulators have threatened to discontinue its funding from Medicaid. According to Bloomberg News, authorities backed down after the company claimed that eliminating its government funding might cause clinics to close and disrupt care for thousands of poor children. It still has to answer for some allegations, including an audit report from April that suggested that children who visited a Maryland clinic were restrained improperly and subjected to unnecessary root canals on baby teeth. The company has now renamed itself and claims to have a new vision for providing care for those in need. According to a new survey from the ADA, Americans just barely pass the test when it comes to knowledge of their oral health. Americans scored an average of a D on true or false questions ranging from how often to brush to what causes cavities. Here are some of the most common misconceptions. 90% of respondents mistakenly believed that they should brush after every meal when the ADA recommends only twice a day. 65% believed toothbrushes should be replaced twice a year when the ADA recommends every 3 months. And 59% didn't realize cavity-causing germs can be passed from person to person. The ADA has coincidentally launched a new website, mouthhealthy.org, dedicated to improving the oral health of all Americans. Coming up, products and procedures, but first, here is a brief message.
We have great news, really great news, for all dentists. It's about digital. Dentistry today is now bigger and better than ever before. Now, why do we say that? Our content has expanded to a broader spectrum. We continue to evolve in all directions the internet takes us. And now, our digital family includes weekly DNN broadcasts, online continuing education, monthly digital editions, live blogs, and more. So why should you follow us? Dentistry Today's online content is unique, and you can't find it anywhere else. Our news stories are updated on a daily basis. We have an extensive archive library of all of our clinical content. Nowhere else can you get the best continuing education courses. Our growing presence on all social media sites really speaks for itself. And that's not all. We are the nation's leading clinical news magazine for dentists, celebrating our 30th anniversary. So what are you waiting for? Start browsing our website now. You can find us at Facebook/Dentistry Today, Twitter/Dentistry Today, and YouTube/The Wednesday Watch. And of course, dentistrytoday.com.
And now, products and procedures. Dux Dental announces the new zone-free temporary cement. It can reflect the color of any adjacent surface as it contains prismatic color-blending nanofillers. It helps create a natural look that blends with the color of the patient's own teeth, crowns, or other surfaces around it. Zone-free is easy to apply, easy to clean up and remove, and provides excellent retention strength. When it is dispensed, its pearly white appearance gives it enough color to allow the dentist or assistant to place it precisely and see excess cement during cleanup and removal. Yet when it is spread thin, it blends with adjacent surfaces, creating a chameleon effect, resulting in a natural, aesthetic look. Zone-free has a working time of 1.5 minutes and self-cures in 2 minutes with no need for a curing light. For more information, visit duxdental.com. Protect against the effects of acid wear, a major cause of tooth surface loss, with Sensodyne Pronamel toothpaste. This unique foam gel disperses rapidly throughout the whole mouth because it is activated by the elevated temperature in the mouth. Modern diets allow teeth to be exposed frequently to dietary acid, which may result in acid wear. Sensodyne Pronamel has an optimized fluoride formulation proven to reharden acid-softened enamel. For more information, visit dental-professional.com. Thanks for checking out the Wednesday Watch. We'll see you next week with more from Dentistry Today and DNN.